Well, let's tackle some of those issues with my next guest. It's Niall Dickson, who's Chief Executive of the NHS Confederation, and they're a body representing the whole of the NHS. That's health and social care, hospitals, community trusts, and ambulance trusts, and independent sectors as well, providing care, and clinical commissioning groups. So, Niall, your organisation sort of oversees the entire NHS organisation. Are you confident that the NHS is prepared and ready and able to deal with if we do actually get a full mass pandemic of coronavirus?
Well, I think it's as prepared as it can be. On the one hand, there's no point sitting here complacently saying that 70% of the population get hit by this. The NHS will just continue as of normal and will be all right. Of course it won't. The NHS on a day-to-day basis at the moment finds itself dealing with very crowded surgeries, GPs under enormous pressure, community services stretch, and as we know, always reported, the fact that hospitals from their accident emergency departments through their wards, they're all very, very busy. The good news, I think, or two bits of good news, if there is any in the midst of all this, but the two good bits of good news are, first of all, the NHS has a very good record at flexing. That means that it's quite good at looking at the cases that it's dealing with and saying, okay, those are not absolute priorities, so we won't deal with them. And that means, and that's what I think you'll see more of today, it's not tomorrow we're going to move to this situation. At the moment, we're trying to contain this thing, and broadly speaking, thus far it's been okay in terms of containment, but the expectation is that's not going to work. We are going to have more and more cases. So the NHS will have to start to flex. That means that things like operations may have to be deferred. It means that, not now, but at some point. And what's happening within hospitals at the moment, and indeed with all the other services, is that they're going into even more detailed planning. So a lot of the early stage stuff was about specialist units that would deal with very sick people with these viruses. I think now the situation is that we're really saying that every hospital should detail planning about its supply chain, about how it's going to cope with very large numbers of people who might need to be treated. Remembering, though, the other second bit of good news is the vast majority of people, this will be a cough, maybe a fever.
Yes, I mean, and this is one of the encouraging things, actually. The vast majority of people won't even know they've got it. And
that's
again,
a bad thing as well.
Yes, because they don't. Yes,
know you've got it.
No, this is true. But there has been a little bit of a sort of perhaps a flippant attitude from quite a lot of people. I don't think necessarily in positions of responsibility, but sort of, oh well, it's only a death rate of 2%. Well, that's double that of the flu pandemic we saw in 1918, which wiped out tens and tens of millions of people across Europe. And again, this idea that, oh well, it's the elderly. Well, that'll be most of our parents and grandparents we're talking about. People are being perhaps a little bit careless in their attitude towards this, aren't they?
You're absolutely right. I don't think we should be blasé. On the other hand, I don't think actually panic itself may cause more problems than it's worth. So it's getting this balance. It's just quite difficult. On the one hand, saying this is a really significant threat. It's not just us saying it. The World Health Organization says it as well. We are much more sophisticated at how we deal with these things than we were back in 1918. So that is a good thing.
Yes.
And we will be able to, I think, treat people. We don't really understand the mortality rate because I don't think it's been around long enough, and we haven't seen it in more developed healthcare systems and in more developed countries in very large numbers.
And that's it. We are seeing very different death rates in for instance, in Wuhan than we are seeing in Western nations. And again, in Italy, they've had 34 deaths, about 1,700 confirmed cases. In terms of how the NHS is going to cope, though, as you say, that we may well be able to cope with the number of patients who need hospitalisation for coronavirus, but that will mean a massive knock-on effect in terms of routine surgery, routine treatment that is going to fall by the wayside. We could see waiting lists long after the coronavirus epidemic has passed, but still sky high as a result, couldn't we?
Yeah, I think you could see them higher. I mean, obviously, if things slow down, then the waiting lists will build up. And already we are seeing a situation in which waiting lists are nothing like as bad as they were in the 1990s, but they have started to climb. And that is simply because we haven't invested sufficiently in the NHS over the last 10, 12 years, and we started to have difficulty in keeping up with demand, which continues to rise. So I think there is a challenge for government here. I think the NHS will respond to the pressure. I can't say everything will be fine no matter how many cases it's going to deal with. You know, if the cases go up in a very, very large way, then the health service will be stretched because, of course, it's not just about money and resources, it's about people. And, of course, health service staff themselves will be affected.
Yeah.
But I think we are pretty well prepared. I think the warning shot for the government is, and they have said they will produce more money, but it is, as you say, not just sort of recovering from this situation or managing the situation. It's the aftershock of this and the effect that it could have on waiting lists and waiting time and the kind of investment that would be required to try and tackle that.
Well, a lot of media was reporting this morning. We spoke to the Health Secretary about it, this recruiting an army of volunteers. We know, volunteers often help out in feeding patients in elderly wards and the like already. However, we do have a staff shortage. There are a huge number of staff places across the NHS hospitals which are not already filled. We've got a lack of clinicians, nurses, doctors across the board. Are you confident that your members in the NHS have got enough staff to deal with this crisis?
We certainly want more, and I think in terms of this escalation, I think the idea of encouraging people who are recently retired and so forth and who've got skills to come back in. So I think there are ways in which you can supplement it, and of course, as we talked about, getting volunteers in. But yes, of course, we already have a very significant, probably around 100,000 vacancies in England for health, and then social care is another. Social care, very fragile area, and we have significant shortages as well at the moment in that area, and quite a challenge going forward in terms of keeping, for example, staff from the European Union who form a very large part of the workforce. For example, in London, around 50% come from the European Union. So we've got a fragile social care system and a health system which is, just is managing, as it were, at the moment, but under enormous pressure. And of course, if the coronavirus hits, then staffing will be a very significant issue. But again, in the same way as people flex in terms of resource and, for example, moving patients who are less in need out, they will also find different ways of using staff so that they're targeted at those most.
Okay. Niall Dickson, really appreciate you taking the time to talk to us. He's the Chief Executive of the NHS Confederation.